So we have the chance to talk to Professor Frank Schwarz from the University of Frankfurt in Germany. Hey, Frank.
Hello, Bettina.
You are invited co-chair of the 4th working group, which is about surgical interventions for peri-implantitis diseases. And you also discuss adjunctives to surgical therapy. What does it include?
So, well, the surgical treatment is really complex, both from the clinical perspective, but also when looking at the papers. So there are a mixture of numerous different components. So we have sorted out the major components, including adjunctive or alternative methods for the surface decontamination, chemical methods, and of course reconstructive procedures. So this is what we have tried to sort out. And this is really complex, but we are on a good track to come up with good conclusions.
Yeah, best of luck for this. So you are a world-renowned expert for peri-implantitis and treatment of peri-implantitis. So from your personal perspective, what is so special about peri-implantitis?
Well, really special is that as opposed to teeth, we have a plethora of so-called iatrogenic factors. So we have to deal with implants that are not in the perfect position. We have to deal with compromised soft tissues. And this is, of course, the clinical reality, and this is not reflected in the studies, but this is what we have to deal with on a day-to-day clinical basis. So actually this is the true challenge, to find the right treatment for the right patient and the right indication.
Mm-hmm. So you have been to so many guideline workshops, on the national level, but international as well. What are your highlights here in La Granja?
So this is always this unique atmosphere. Gathering people with the highest level of expertise is so fruitful, because you learn every day, every minute, you have the exchange, and this makes it so fruitful and so special. So this is really enjoyable.
So thank you for your time.
Thank you very much.